President Trump just now tweeting, quote, totally clears the president. Thank you. Now, we got to figure out what that means. We're going to stay on that story for you. Tonight, we've got the news coming in on Michael Cohen, Paul Manafort, and James Comey. Trump could be talking about any one of these men. We're going to bring more on that later in the show. Bernie Sanders whipping a fastball by Stephen Colbert on The Late Show last night. Listen to this.
A few years ago, when we said that health care is a right, not a privilege, and that we should create a Medicare for all single-payer system, I was told I'm crazy, it's extreme, I'm a fringe guy. 70% of the American people in the last polls that I've seen now support Medicare for all.
Okay, that's one poll that used the term Medicare for all. However, the poll numbers drop dramatically when people are instead asked, do you support single payer? The Washington Post Kaiser Family Foundation poll says 53% of Americans support single payer, 43% oppose it. That's a lot different from 70% in support. Joining me now, Fox News contributor Deneen Borelli and Democrat strategist Nathan Rubin. Great to see you guys.
Thanks for having me.
You know, Deneen, even Democrats in California and Vermont rejected single payer, fearing it would bankrupt the state. Colorado, too, rejected it, saying it's going to bankrupt the state. Doctors and hospital staff say it's single payer. It will collapse the healthcare industry. Your thoughts on that?
Yeah, well, they would be the ones to know the reality of what Bernie Sanders is trying to sell. Listen, anytime the words free come up, people should pause and take note because nothing is free. There are input costs for goods and services, and Americans are not stupid. So what you don't want is for the government to be involved to control really your healthcare needs and services, because when the costs skyrocket, what they're going to do is rationalize healthcare. So they will be picking and choosing how and when you should get coverage and by who.
Nathan, I've talked to brain surgeons. I've talked to breast cancer surgeons. I've talked to nurses. They all say single payer would be the worst thing to hit this country. We understand we want to take care of the poor, absolutely, and get them the care they need. They keep saying this is not the way to do it, to have the government control your health care. It would the Sanders bill would wipe out existing insurance. It would replace everything across the board. We would be reporting to the government. Your take on this?
Well, I certainly think that it's a delicate issue, and the numbers that you've presented there, I think it indicates that healthcare policy is complicated. If you look at the numbers of support for the Affordable Care Act, those are going to be different from Obamacare when people are asked, even though they're the same bill. So I think the nomenclature that we use is complicated, number one.
Well, how about just saying the truth, that it is single payer and it's government-run health care? I think people are basically, they get fastballs whipped by them when you call it a nice, soft name like Medicare for All. It's not that. It will replace all insurance across the country. Employer insurance, any insurance you've got. Go ahead.
Well, I think what people are coming to terms with is that the idea basically that if you or a loved one gets sick, you shouldn't have to go bankrupt to get them the treatment that they need.
Understood.
So whether that's a single payer system or a Medicare for all system, I don't know the specifics of what Bernie Sanders is introducing in his bill, but I think that value, that understanding, is starting to resonate with the American people.
Understood. And Deneen, people in the healthcare system say that the cost is so high because the government already dominates half of the healthcare industry. And half their time, majority of the time, they're doing paperwork, not treating patients. Your take on this?
Well, sure, and that's going to come down to what kind of service that you get as well. When you have the likes of Bernie Sanders trying to push this, saying that it's free, what they're doing is misleading Americans. They are putting them on the wrong page, and they're not really presenting the facts to them. So I think it's really important for folks to realize and recognize what Bernie Sanders and those who are in support of single payer, what this really boils down to. And it's going to come down to the government, the bureaucrats, picking and choosing for you and your family how and when you should get coverage or services from doctors and hospitals.
Deneen, Nathan, thank you so much. We're going to see you again in just a bit. Coming up next, we've got a jam-packed rest of the show for you. Michael Cohen, Paul Manafort, both on the hot seat, both being charged with lying and much more. That's the latest word tonight from federal prosecutors. We've got Bill